Tom Harkin, a great and longtime friend of doctors of optometry in Iowa and across the country, will retire from the U.S. Senate when his current term ends in 2014. The American Optometric Association is proud to salute him at this time with the Apollo Award, optometry's highest honor that recognizes distinguished service to the visual welfare of the public. During 40 years on the national scene as a legislative force and through unflinching leadership on healthcare policy issues, Senator Harkin has shaped the federal laws and programs that assure patient access to the full range of care provided by the nation's optometrists.
To me, optometric care is an integral part of the health care system of America, and is also, as I like to think, is a part of prevention and wellness and keeping people in better health.
In the 1980s, Senator Harkin backed Medicare parity and full physician status for optometrists. In the 1990s, he championed expanded funding for optometry-led eye health research. Since 2000, he helped pass a decorative contact lens consumer protection law and even secured direct federal appropriations for the AOA's life-saving and sight-saving Infant C program. In doing so, Senator Harkin always looked to Iowa optometrists and the AOA as key backers, ready to provide important information and ready to help him get things done. Senator Harkin continued to look to optometry in 2009 when he assumed the chairmanship of the Senate Health Committee and took on the job of crafting legislation to expand health insurance coverage to millions of uninsured Americans. It was his initial proposal that included the recognition of eye health care for kids as essential. It is this provision that became the foundation of the comprehensive pediatric eye health essential benefit that, starting in 2014, requires new health plans to cover an annual eye exam and follow-up care through at least age 18. But it's the first of its kind national patient access law that bears his name that will be the senator's most enduring legislative achievement.
The Harkin Patient Access Amendment was designed to end decades of discrimination by requiring insurers to recognize the full range of medical eye care services that optometrists provide.
Congress's passage of the landmark Harkin Law in 2010, which is a strict federal ban on discrimination against ODs by health insurers, including ERISA plans that have a long history of anti-optometry discrimination, was the culmination of years of hard work and the determination to take on and defeat the powerful special interests that opposed it. Thanks to Senator Harkin, it is now being implemented today in all 50 states and the District of Columbia. It was a difficult road to final passage, and it hasn't gotten any easier since then. Just weeks after it was enacted, in spite of the fierce opposition of the health insurance industry and organized medicine, a resolution was drafted for the American Medical Association House of Delegates seeking to condemn and repeal the Harkin Law. Ever vigilant on this issue, Senator Harkin remains fully engaged in responding to such attacks. With the U.S. Senate in session today, Senator Harkin's official duties have required that he remain in Washington, D.C. Though he recently accepted the Apollo Award presented to him in his Capitol Hill office by the AOA Washington office team. He provided the following message of thanks, especially for this meeting of the AOA House of Delegates.
Hello, I'm Senator Tom Harkin. I regret that Senate duties prevent me from being with you in San Diego, but I'm truly honored to accept the 2013 Apollo Award from the American Optometric Association. I thank all of you, in particular AOA's President and President-elect Dr. Ron Hopping and Dr. Mitch Munson. I also want to thank all the doctors of the Iowa Optometric Association, especially the President and President-elect Dr. Scott Bowker and Dr. Craig Rock, and of course our Executive Director Gary Ellis for their kindness in nominating me for this award. Optometrists have been my friends since I first ran for Congress in 1972, and I have the greatest respect for the role you play on the front lines of care and also as real pillars of your communities. And that's why I've worked so hard to ensure that your profession is fully recognized in federal law and in federal programs and treated fairly by health plans. I especially appreciate your role in ensuring that comprehensive vision care for children is designated as essential in the Affordable Care Act. Eye health coverage for children is about as essential as it gets, and thanks to your support, it's now the law of the land. Starting in January, pediatric vision care will be integrated into a family's comprehensive coverage. That's truly historic. But it's not all we did. When the AOA first approached me about the need to write and pass the first federal law aimed at barring discrimination against optometrists on the basis of licensure, I knew we'd be taking on some powerful special interests. But together we fought hard, we made our case, we won new supporters. Most importantly, we outworked our opponents. The result was the first ever federal provider anti-discrimination statute. Discrimination against optometrists by health plans is now a violation of federal law. So again, friends, I thank you for this very generous award. I thank you for your role in passing and implementing a strong Affordable Care Act. I thank you for the important work you do in communities all across America. So I wish you a very productive gathering in San Diego, and by all means, a safe trip home afterward.